Okay, I decided to become a safety coach because in my previous job I had done safety as well, and I think it's an important thing. A lot of times it gets overlooked. Sometimes we get complacent. We do things in a safe manner, but then as we get through the day or we get tired, we tend to forget it. And I think an extra set of eyes, even from a different discipline, can kind of help us remember and remind us that where we need to be.
From my point of view, we've definitely seen great success with the program. We have our near misses and good catch stories, so we can see across the network that there's really been good results. And even in our own clinic, we know that we've noticed some things that maybe we see every day, but we may overlook.
I think more often than not, we do an unsafe act is well, I've done this 100 times. And that's where we make the mistake is because I've done this 100 times is kind of like a default to saying, well, I've done this 100 times and I haven't been hurt, so I won't get hurt. Well, that's not really a truism. That just means that the law of averages haven't caught up with you yet. So you could do it 100 times, but you could hurt yourself on the 101st time. I want to hopefully that you can do it 10,000 times and never hurt yourself.
So I think the more the safety coaches observe things and document them, the less issues we will have in serious problems such as deaths to occur within MedStar. I think it also gives administrators a key tool to look at, and when they have their meetings, they can say, well, we need to focus on this a little bit more because I'm starting to see more of these things happening as opposed to this.
So when this initiative was developed, it really complemented very nicely the initiative that we were already taking. Not only do we want rapid access and high quality, but we want it in a safe environment. So these two initiatives together have worked very well towards accomplishing that goal.
I look at it from the point of view that we know these things, we just need to be refreshed on it, reminded of it. So I don't really lecture. I just kind of, hey, remember we need to do this and be careful with that type of thing.
As a safety coach, I don't only act as an ambassador for my department, I also look for things when I'm in the hallway of our building, whether it's the cafeteria, the public restrooms, to ensure that not only that the patients are safe, but staff as well.
And by having this dialogue and open discussion, we've been able to make changes and also commend each other on the things we're doing so that we can focus more and continue to implement the skills that we're using.
Because we get busy and we want to hurry, and a lot of times, not just in facilities but anywhere, a lot of times when we want to hurry, safety is the first thing that we sacrifice. And I don't think we should do that.